That was President Biden speaking outside of Brooklyn Middle School in Washington, D.C. after he announced sweeping new vaccine mandates yesterday that will affect about 100 million workers across the United States. The president today in his speech there is encouraging kids over 12 to be vaccinated as well. He says to protect our schools and also help protect younger children who are not eligible to be vaccinated. So I want to bring in Chief Innovation Officer at Boston Children's Hospital, ABC News medical contributor Dr. John Brownstein for more on all of this. Dr. Brownstein, as always, thanks for being here. What do you make of the president's remarks both yesterday and today and his plan to tackle COVID in schools? Essentially, it sounds like he's just encouraging older children to get vaccinated and encouraging masking in schools as well.
Yeah.
Is it enough?
Well, thanks, Diane. I think that the reality is that, the president is tired. We've tried the education, we've tried incentives and pleading, but it's just not working. And so these sweeping vaccine mandates are really to drive that additional number of people to get the vaccine to finally be at the other end of this pandemic. With respect to schools, the Biden administration is acknowledging how important it is for our kids to be in schools. We've been talking about it a lot for the last year, but this is as we've seen the highest rates of COVID in kids. But we know what works. We know that if you follow the science, masking, vaccination, testing, and ventilation, all of these things together can work. And so the Biden administration is putting together a strategy, requiring staff of Head Start programs and DoD schools to be vaccinated, calling on, states to adopt vaccine mandates, trying to increase testing. We know that they're using the Defense Production Act to ramp up testing. So let's bring in testing into our schools to make sure that our kids are safe, and providing resources to the FDA to finally get that approval in the under 12s. I think that, of course, we want 12 and over to get, those vaccines. He can't mandate that in a sense. He's mandating, teachers and other places where he can. But yes, he's encouraging, anyone who can get the vaccine now do so to have a normal school year.
And I think everybody wants to see kids back in school and stay back in school instead of, resorting back to remote learning. But COVID infections among children are now 1 in 4 of all new cases. So are these measures that you're describing and that the president's aiming for, are they enough, do you think, to reverse the course of the surge that we're seeing right now and keep kids in school safely?
Well, I'm concerned. We are seeing that exponential rise in cases. Over a quarter of cases are kids. We're seeing greater numbers at any other point in the pandemic. At the same time, we know we have tools around testing. We have not implemented those at scale yet. We know that if we can bring in masking and social distancing and proper ventilation, the schools who have done that have been able to stay in class all year this past year. And the schools that didn't do it often had to shut down. So yes, this layers of intervention that we can bring in are important. And I think providing the resources to the schools to do this has been super important. I do think it's possible, it may not reverse the course, but it may allow for our kids to stay in school. And, that's exactly what we want. I think, of course, we have a concern here in Boston. We're in the potential beginnings of the surge. And the last thing we want to do is start to go back to a shutdown situation where, my kids are back at home. I think we can get there if we do all the things that, the Biden administration has laid out.
Now, Los Angeles is now the first major school district in the country to mandate vaccines for kids 12 and older. Do you think other school districts will follow now? Is that the new way forward?
I personally think that is, for those who are eligible, we know these are incredibly safe vaccines. We do this for other vaccines, right? Chickenpox, hepatitis, MMR. This is a requirement for kids to go to school. Adding in COVID into the mix, a very safe vaccine that keeps our kids in school is important. And I think, LA was out in front here, but I think what we're going to see is broad adoption of this policy. I think, this is the first of many jurisdictions that are going to take this on.
Yesterday, the president also unveiled his new 6-part strategy to fight the Delta variant overall, and it includes some controversial vaccine mandates for millions of Americans. What do you think of the plan and of the president's tone yesterday? As you alluded to, he essentially sounded fed up with anyone who isn't vaccinated at this point.
Yeah, listen, we have a lot of data on this vaccine now. We know that, vaccinated people are not the ones that are in hospitals right now. We know that they're not the ones dying from COVID. And yet we are still at, 1,500 deaths a day mostly driven by unvaccinated populations. They are the populations that are driving this pandemic and really impacting public health, but also the economy. And so at this point, whereas, we were at the incentive, process, a couple months ago with lotteries and free beer and free, baseball tickets. Now it's like, if you want to participate in society, if you want to, remain, employed in your job and, be, a productive member of society, now you should do what's right for yourself, for your family, your community, and get the vaccine. So yes, I understand it'll be controversial. There is the testing option, for those who do not want to get the vaccine. That will be painful, but it is, that is an option for some. But really, for most of us, this vaccine is our tool out of the pandemic.
And the president's also requiring vaccinations for 17 million healthcare workers. What's your take on that?
I mean, I'm in a healthcare system at Boston Children's. We're mandating that. I mean, if you want to be in a position that you're taking care of patients, the most vulnerable, chronically ill, how can you have an interaction with, a healthcare provider that may not be vaccinated and putting yourself and your family at risk? I mean, it's basic concept. And of course, again, we mandate the flu shot every year in our hospital and most hospitals across the country. We recognize that we need to protect our patients, and we also have to prevent a surge in cases. And so we're applying the same logic to COVID. We do not want to be in a situation where we have clusters of cases where we have to potentially shut down units of the hospital or put our patients at risk. So it's the right call, and we should have been doing this all along.
All right, Dr. John Brownstein, it's always great to talk to you. Thank you.
Thanks, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.